Hi Rose, my name is Megan. I'm the nurse taking care of you today. I have some instructions for you before you head home. It looks like Dr. Burke went ahead and wrote orders for you to be able to be discharged, and you'll head home and just manage your care there. Do you have any questions before we get started? No? Okay. I know that you just had a baby. You had a vaginal delivery, and baby's doing well upstairs in the nursery. She's going to stay here and be just monitored for a little while, and you can certainly come and visit and stay with her throughout the day, and she should be heading home soon. So I have some information to give you before you head home. First and foremost is just the care of your body after having a vaginal delivery. You want to make sure that you're taking care of yourself, staying hydrated. One of the things is that at the hospital here we give you the jug of water to keep at your bedside. You can take that home with you, and just make sure that you're filling that up quite a few times throughout the day. Aim for 4 or 5 times that you're filling it up and drinking. Staying hydrated is going to be your best friend in keeping your body healthy and healing up really well from the delivery. So it doesn't show in here whether or not you had an episiotomy. Did you have an episiotomy? No. Patient did not have an episiotomy. So we're going to focus our learning about pain relief. And some of the things that you can do for that is the medication that doctor's going to send you home with. But some other things are, you've heard of, we've talked to you about a sitz bath, and that's where you sit in warm water in the bathtub for just 2 or 3 inches of warm water, and that can help soothe your area down there to reduce swelling, reduce the pain. It can just be very soothing to do that. You want to make sure that while you're still bleeding that you're not using tampons. You want to use maxi pads instead. We have a stack here that you can take home, kind of the bigger ones, that also have a breakable ice pack in them. So you're just going to break that, shake it up a little bit, and then stick it just like you would a regular pad. They're going to absorb a lot more and offer you some comfort with the ice. And if you run out of those, you can always take like a bag of frozen vegetables, put it in a dish towel, place that over your privates. That can help reduce some swelling too. You want to watch your bleeding. If it becomes increased significantly, or you see any like big chunks, we call those clots, coming out, make sure that you give your doctor a call and just explain what's going on and how long it's been that's been happening. You want to rest as much as you can. Just like with tampons, you don't want anything inside your vagina right now. So no sex at this point until you're cleared by your doctor. And you just want to rest your body. So if you have something that needs lifted that's heavier than the size of your baby, you want to ask mom and her significant other if they can help you out with that. Just accept the help for right now, and let yourself be taken care of. Kind of baby your body a little bit. That being said, you do want to stay active. So taking a walk is a really good thing. Kind of get your muscles moving and blood flowing throughout your body when you feel able to, and you don't have to do a marathon, no jogging, running, nothing like that. Just a walk around the block is a really good stress reducer and energizer, and just keeping your body healthy. So I think those are all the things I wanted to tell you about vaginal care, or vaginal delivery care. Do you have any questions? Okay, no? Okay, I also wanted to ask if you are breastfeeding, because I don't see that here in your chart. You are breastfeeding. Okay, so then we also want to talk about some signs and symptoms to watch for any kind of infection. A common thing that can happen to women who are breastfeeding is called mastitis. And what that is a clogged up, infected milk duct in the breast. So a really easy way to check for that is pain is going to be your first symptom. Pain, and if your breast is hard, or it is hot, if you feel feverish on your breast, and that just, that's you checking your breast on a regular basis, kind of feeling around any lumps, bumps, that sort of thing, that feel out of the normal for you. And since you are headed home and baby's staying here for a while, I'm going to send you home with a breast pump and demonstrate to you how to use that properly. And then you can demonstrate back to me so that I can know that you're using it properly and safe and effective. Okay, so I'm going to show her how to use the breast pump, and then she's going to show me back, and she does so and does a great job. Also, if you have any questions on that, I have some phone numbers here for lactation specialists. I know you saw one earlier, and they can kind of help you with the transition from pump to actual baby to breastfeeding as well. So I'm going to give you that information there. Another thing is nutrition. I know in the past that you've struggled with some eating disorder, sometimes in your life where you had some eating disorder problems. I can't stress enough how important nutrition is for your body and for baby, especially with your breastfeeding. So for one, healing after such a traumatic event to your body, such as the delivery, and for two, providing those nutrients to baby. So you want to make sure that you're consuming enough calories throughout the day, and that you're eating plenty of protein and fiber. Are all really good things, and that's going to keep you healthy, heal you up quicker, and provide everything that we want baby to have. So I have some information here that I'm going to give you on different kind of diet considerations for breastfeeding women after delivery. I do see that you are a current smoker. We've talked about marijuana use, how that's not very, super safe with baby. I know it's been a long time since you've done that. But with smoking cigarettes, do you have a desire to stop? Are you wanting to put those down or not? Okay, she does have a desire to stop. So I want to give you some information on different ways we can kind of help you through that, because it doesn't have to be cold turkey if you can't go that route. That route is of course the best because, get it out of your system. But we also understand that that's hard too. Any route that you take is going to be difficult. So we do have resources. You can talk to your doctor about different kinds of medications that are safe for breastfeeding to take while to stop smoking. Patches, that sort of thing. But there's also alternative measures. So here at the hospital we have acupuncture, we have biofeedback therapy, we have counseling, that I can get you hooked up with everything to see if we can't get you successful in your wanting to quit. If for some reason you decide not to and that it's not for you right now, just some things to keep in mind. Don't smoke in the same room with baby or in the same house, the same enclosure. So stay outside of the house, no smoking in the car with baby. Secondhand smoke is easily transmittable to baby when you're smoking around them. So we don't want baby to ingest any of that, inhale any of it. It's a good idea to wash your hands frequently anyway, but especially again with smoking, you want to make sure you're washing your hands when you're done. Maybe wear a jacket when you're outside and then take that off when you come in, that sort of thing, so that we kind of reduce and limit the amount of smoke that's coming and getting the baby. So then we have your medications. Your medications that doctor is sending you home with, you have 5 things that you're going to be taking. So because of your blood pressure, which is coming down now, but it's still a little high, doctor wants you to be on blood pressure medication when you go home. So this is labetalol. Labetalol is going to bring your blood pressure down. So some things you kind of want to watch for is dizziness, especially coming from like sitting to standing motion. If you are experiencing that, stand slowly. When you need to get up from the chair, get up from bed, make sure you sit up all the way first, kind of sit there for a couple minutes, let your body get used to it, and then slowly stand up so that your body can adjust in a slower amount of time and not get that dizziness to where you could pass out and hurt yourself. So that's a labetalol. You're going to take that twice a day. The best way to do that is in the morning with your breakfast, and then you're going to take it at night either with dinner or before you go to bed. You don't want to stop taking that medication abruptly. So if you feel like your blood pressure is doing better or it's getting too low or whatnot, make sure you talk to your doctor. Call Dr. Burke and talk to him, because this doesn't have to be a lifelong thing that you're on the labetalol, but to come off of it, you want to taper down. You don't want to quit cold turkey. What can happen with that is that you stop taking it and all of a sudden your blood pressure skyrockets. So we want to kind of, just like with standing up, kind of slowly adjust your body to it. So the second medication that you're going to take is iron sulfate. That is an iron supplement. It's ferrous sulfate. The iron supplement is just to kind of help restore those iron stores in your body. A lot of times after a delivery of a baby, we lose blood, where our body's fighting to get back to normal anyway, and that just kind of helps out, get everything kind of back to regulating, back to normal. You might notice that you're more tired, or you just don't have the energy, or you're more pale, and that's because you need some more iron. So this is going to be taken once a day in the morning. It's best to take it on an empty stomach. The problem with that is that sometimes for some people it upsets your stomach. So you want to take it with something like fruit juice or an orange, something citrusy like that. You do not want to take it with any kind of milk products. Milk is going to keep it from getting into your system. So if you take that with a glass of milk, it's just like not taking anything at all. Kind of defeats the purpose of it. So make sure that you're taking the medication before you take breakfast in the morning, about an hour before, and then kind of adjust that as you see how your stomach's tolerating it. Add in orange juice or whatnot if you need to. So a pretty common typical side effect of taking the ferrous sulfate is that your poop is going to be really, really dark. It also might be more difficult to poop. So another thing that we give very typically along with that, the iron supplement, is a stool softener. So here we have Colace. You're going to have Colace to take twice a day. Colace is not a laxative. It's not going to turn it to diarrhea and have cramping and that sort of thing typically. What that's going to do is just get more moisture into your poop, and so it's going to be easier to come out. It just makes it a little softer, hence the stool softener. So you want to take that twice a day. You can take that along with your blood pressure medication too. And the last thing that Doc is sending you home with is Tylenol and Motrin. These are both 600 milligrams. You can take these every 6 hours as needed for your pain. The Tylenol is going to be more pain-based, and the Motrin is going to be pain and inflammation, swelling, that sort of stuff. That's going to help with that. So you can overlap these, but you need to make sure that your doses of each kind are taken 6 hours apart. So don't take another dose of Tylenol until it's been 6 hours since you took Tylenol. So I know all of the medication can be kind of confusing. So what I have written out here for you is a schedule of when to take what medication and different considerations for the ones. So like with the ferrous sulfate, not taking it with milk. With the blood pressure medication, just watching yourself as you stand. paying attention to your body and how that's reacting. So that could be helpful for you. You can take that home as well. You have 2 appointments coming up, and we went ahead and scheduled those appointments with Dr. Burke's office. The first one is in 2 days. That's October 4th. You're going to go in and just get a lab draw. You're not going to see doctor. You're just going to go in for a blood draw. They're going to take some blood from your arm likely, and so that they can test that and make sure that all of your blood levels are good, you don't have infection, your kidneys, your liver's working, everything like that. And we're just doing that because you're taking the medication, you're new to the medication, and you just had babies. So they're going to do that on October 4th. And then 2 days after that, you have an appointment face-to-face with Dr. Burke. By then, he should have those results, so he can go over those with you. And you'll be able to ask questions, hopefully get some answers if you do have questions, and have a physical exam. So he'll be going over, do a vaginal exam and make sure that you're healing up really well. He'll ask you a bunch of questions about how you're doing since you've had baby, how baby's doing. If baby's home by then, feel free, go ahead and bring baby with. They love seeing how they're doing. So something that helps a lot of people is that if you write down questions before you go. So it's really easy to, 3 o'clock in the morning, waking up, have a burning question for your provider. And we feel like, oh, it's so important, I need to remember to ask, but it's really hard to remember all of those little times, all of those little questions by the time that our appointment gets here, right? So I'm going to send you home with this notebook, and I want you to write down any thoughts that you're having, any questions, any concerns. Just go ahead and start a list so that when you go see doctor in a week, you'll be able to have that with you and be able to remember all the things that you were wondering about at one time. So I know that we've been doing screenings with you for any kind of sadness or depression, and that you've heard about baby blues. It's really common to kind of, with the surge of hormones and whatnot, to kind of feel a little down and blue after having a baby. But one thing that is quite serious that is more common than a lot of people realize is postpartum depression. So just to be aware of that it doesn't hold stigma that you are wrong or bad or not a good mom or anything like that. If you are feeling a danger to yourself or to baby, if you're feeling more sad than normal, if you're feeling like you just can't go on, we want to make sure that you give us a call, because nobody needs to feel like that. Nobody needs to go through that alone, and there are options for you out there if that happens. So if that's happening, just, give Dr. Burke's office a call, let them know what's going on, and they'll be more than happy to help you through that. Okay, I think that is all I have for you right now at this point. Here is the handouts that I'm going to give you about nutrition, different kind of dietary needs that you have with being a new mom and breastfeeding. Who does most of the cooking in the house? Oh, Mom does. Okay. So Mom, I want to make sure that you understand, I'm sure you're well aware, having had a child before too, what kind of nutritional needs that she has right now. She needs high protein, she needs a good amount of fiber, lots of fresh fruits and vegetables, lots of red meat is going to help with that iron store kind of building back up. And you're probably going to feel more hungry, and have healthy snacks on hand too is another really good one. So I have that for you. Go ahead and look that over too, Mom. I'm able to do that. I have your appointment cards, and I think that is all I have for you today. Do you have any questions for me? Okay, no questions. All right, well, I wish you the best of luck and congratulations.